stress-related disorders presentation. This is about the treatments for these disorders. So first up, treatments for PTSD, cognitive behavioral therapy. This one's going to pop up a lot, and it's found to be pretty effective for people with PTSD. CBT focuses on identifying, understanding, and changing negative thinking and behavioral patterns. So it encourages the patient to, they'll have the appointments with their psychologist, but it also encourages them to learn new skills in how to kind of stop those negative thought patterns in their tracks. So it's not just going to therapy and talking it out, it's actively regaining these coping mechanisms that they might not have because of PTSD. So different types of CBT have been widely studied, and they're supported by a lot of empirical evidence, especially for younger people. Second one is going to be exposure therapy. So this therapy helps a person overcome their fear of what traumatized them through exposure in small doses. So you can be revisiting places or writing out or purposefully envisioning the trauma. So that happens in a controlled, low-stimulus environment. It's not just throwing the person to the wolves and leaving them at the place where their trauma occurred. But it's controlled and monitored by a professional. And virtual reality, actually, in the past few years has become a pretty expensive but useful method to help people revisit their trauma, because it has that layer of, this is not real, I'm not actually here. So prolonged exposure therapy has been extensively studied, just as CBT has, and it's pretty effective. And prolonged exposure therapy has produced a substantial number of replication studies and longitudinal studies, so it's one of the leading treatments, just like CBT. Third one is cognitive restructuring. So it helps people get kind of a realistic fix on what happened during their trauma. This is especially useful if somebody has suffered memory loss after a trauma. So the first component, kind of the most important component, is aiming to address the patient's dysfunctional appraisals relating to their trauma, and if their trauma left them feeling like dirty, that's pretty common with things like sexual assaults. The second component is imagery modification, so going back and working through those memories and kind of changing how they perceive them and interact with those memories. So that's shown to be pretty effective at actually modifying those stored associations and the dysfunctional beliefs linked to PTSD. And that can also lead to a decrease in those intrusive images and flashbacks. And the last one is medication. Some medications have been found to help along with, of course, psychotherapies, such as SSRIs, which are selective serotonin reuptake inhibitors. Those are antidepressants. Another medication type is benzodiazepines, so typical like anti-anxiety, tranquilizer type medications, but these aren't just solely prescribed to someone with PTSD, and that's treated with solution. Medications are given in tandem with other forms of psychotherapy, so cognitive behavioral therapy, exposure therapy, or cognitive restructuring, and then they're also taking Valium or something like that. Dissociative amnesia treatments, so psychotherapy. So typically that helps just people talk through their trauma and kind of work through it, because dissociative amnesia is linked to that trauma. So the idea is that they might slowly begin to regain their memories through changing their relationship with that trauma. And CBT, again, helps patients understand their own negative patterns of behavior and kind of changing them and learning better coping mechanisms. And then clinical hypnosis is pretty interesting. It focuses on reorienting the patient to experience the amnesiac episode. So they're encouraged to recall memories just prior to the amnesiac episode, and then walking through the event and seeing if they can recover memories, explore their own thoughts and feelings, and go into different states of consciousness and see if they can retain those memories that they can't access currently. So medication, unlike PTSD, there's no really a medication that will fix dissociative amnesia. But antidepressants or other similar medications have been prescribed to people to deal with comorbid disorders, so anxiety, depression, insomnia. Not so much to specifically treat dissociative amnesia, just to increase the patient's quality of life. DID treatments. So dissociative disorders of any kind, as we saw with dissociative amnesia, can't be treated with a specific medication, but several treatment options still are there to help people DID manage their disorder. So psychotherapy, such as CBT, which we talked about before, and then eye movement desensitization and reprocessing, or EMDR, and medications of related conditions. So a big thing that's especially important for people with DID is to get consistent quality sleep, because sleep deprivation has been linked to increased switching between alters. It's not a treatment in and of itself, but kind of taking out that extra stressor and element helps the person manage their alters and switching and things like that and their dissociation. So, cognitive behavioral therapy specifically for DID, we know what it is already, identifying negative thought patterns and learning how to reframe them. But when treating DID, this therapy aims to identify the thoughts and behaviors that lead to those dissociative states and then ground the patient in reality. So, PTSD and dissociative amnesia, they all kind of have different aims when they're dealing with cognitive behavioral therapy. And for DID specifically, it aims to kind of help the patient recognize when they're about to dissociate and work away from dissociating. So this therapy is much more effective than like problem-solving therapies, which focus on finding stressors in daily life and kind of getting rid of them. But instead, building up coping mechanisms has been found to be more effective than just trying to solve everything that might lead to somebody dissociating. So EMDR, it's eye movement desensitization and reprocessing. So it uses a stimulus like this little video. It might get a little loud, so if you're wearing headphones, maybe turn them down. So it'll just be a little light like that, and it's just a light on a bar, and they'll have the patient focus on the light, and this visual stimulus will be used while they're encouraging engagement with traumatic memories. So as a way to mitigate emotional response to those memories. So it's kind of acting as a buffer using this eye desensitization. So it seeks to help people DID access memories that maybe they don't have if they're the dominant personality, but an alter might have. So it's sort of like hypnosis, but not quite. And the goal of treatment for DID is often integration, which is the synthesis of alter identities into the dominant identity. So integration is linked to the lessening of dissociative symptoms, and so is seen as a pretty key part for DID, of treatment for DID. However, complete integration is very rare, which complete integration is when all alters go back into the dominant personality, leaving just one behind. That is very rare. So partial synthesis of some alters into each other is more common. Okay, so related medications, last slide. So there's no specific pill prescribed to treat DID, just like dissociative amnesia, but since DID often overlaps with mental disorders such as anxiety, depression, and PTSD, medications used in treating those disorders is found to improve the patient's quality of life, manage their mental health, and kind of help them on their way while they're also getting treatment for DID specifically. So anxiety, depression, and PTSD are commonly treated with SSRIs. So common SSRIs or antidepressants are Lexapro and Prozac, and benzodiazepines or anti-anxiety medications such as Xanax and Valium. All right, references slide if you want to see that. We'll have all these up with our discussion board. Thank you so much for watching.